as I like to say, we've come a long ways, baby, because we started our HIE discussions back in late 2009, 2010. And so we began the discussion, and at that time, not many people even knew how to spell HIE, let alone, what it was all about. And people had different concepts of what it would be. So we spent about a year really bringing together the healthcare stakeholders in the Inland Empire. And there was a lot of concern, reticence about sharing data, protecting the data, all of the things that I know all of us on this call have experienced in one way or another. And so we spent a year actually educating our community, learning from others who have had either started successful or the failures too. We wanted to really know what it was all about. But what we did is we brought together, IHP was at the table at the very beginning, the Hospital Association, and then of course the Medical Association. So we brought, the key stakeholders together to have the conversation. And then in 2011, our group said, okay, we're ready to do it. One of the biggest mistakes I say of my 42 years now with the Medical Association is back when the ACA was first formed and the ONC funded the EHR projects to help physicians implement an EHR and reach meaningful use. We were part of that, and we helped close to 800 providers in the Inland Empire implement an EHR. Had I known then what I know now, we would not have said, here's a choice of 20 or 200, pick the best ones for you. And the criteria of picking the best one for physician offices was very difficult. And so it came down to personalities and all of that. Had we known then, not to introduce 200 different EHRs and really kind of focus, but we didn't. We had learned lessons. So after about, a couple of years of the EHR implementation, we realized that we created a monster in that none of these systems talk to each other. And hence, the discussion with the HIE was brought about. So in 2012, with all of the stakeholders around the table committed to a self-sustaining model, which meant you had to pay to play. We had to support this somehow. We did stand up the Inland Empire Health Information Exchange in 2012. But then, as we all know, data projects are extremely expensive. And we were at the point 2 years later that we needed to make a significant technology change to move with the future and the size that our HIE had gotten. But then an opportunity presented itself in late 2014 to partner with another HIE that was a very different model than ours. But we recognized that to be able to grow the HIE and to have the type of technology that was needed, it had to be bigger than the Inland Empire. So by partnering, we then formed Manifest MedEx that we're all here today. And that really gave us the opportunity to take the HIE in the Inland Empire and move it to the next level.